Yesterday, I made a request to people all over this country to send us their stories in terms of the impact that the Republican legislation would have on their lives if, in fact, 15 million people ended up losing the health insurance they have through massive cuts in Medicaid and the ACA, and if what people would be experiencing if there was a doubling in their health insurance premiums, which will be the case for some 24 million Americans. And before I get to the folks, the stories that were sent to us, and many hundreds of people wrote in, and we really appreciate that, let me put this in a broader context, and that is that right now, before the shutdown, before a doubling in health insurance premiums, before 15 million people were about to lose their health insurance, ordinary Americans are struggling right now to put food on the table, to pay for childcare, to pay the outrageous cost of housing, to buy decent food for their kids. So it's a struggle right now. 60% of our people living paycheck to paycheck, struggling just to survive, while the people on top have never had it so good. So then in the midst of all of this business, how do I pay for groceries? How do I pay for housing? How do I pay for childcare? Then Trump comes along and says, well, we're going to throw millions of people off of their health care. We're going to double premiums for 24 million. And that's the context in which I said to people just yesterday, please, write back, tell us briefly what the impact of these programs will be on you. So let me read just a few of them. I'm only going to use the first names here. Bobby in Texas, B-O-B-B-I. My husband and I own a small business in Texas. My husband and I are on the ACA. I have lung cancer. I will lose my coverage due to the increase as it already has high premiums. I will die without health care, and so will many others. So Bobby from Texas is writing. Bobby is struggling right now with lung cancer. If these premiums go way, way up, as they will in Texas and all over this country, she want to be able to afford health insurance. If you don't have health insurance, you have lung cancer. The prognosis is not very good. There was a study done a couple of months ago by Yale University and the University of Pennsylvania, and they estimated just in terms of the cuts in Medicaid, 15 million people losing their health insurance, some 50,000 Americans every single year will die unnecessarily. Now just stop, take a deep breath. As a result of this legislation, if the Republican legislation were to go through, and yet a clean CR, 50,000 people a year would die. Jen from New Mexico writes, and I quote, ours would more than double in New Mexico. Our premiums would increase $600, from $600 to $3,800 for the same policy. We have a family of three. If the enhanced subsidy goes away, that's what will happen. We would not be able to afford health insurance. We would be at risk of medical bankruptcy if anything serious happened. I wouldn't get the care I need living with an autoimmune disease. I would have to rethink whether or not I let my kid play soccer, fearing a risk of some injury. At these rates, I don't think catastrophic policies are even affordable. All right, so what is Jen from New Mexico saying? She would likely not be able to have any health insurance. If you don't have any health insurance and you get ill, somebody in the family ends up in the hospital, very good chance you're going to go bankrupt. Your credit rating is shot. Your whole life is deeply impacted. And she's even thinking, kind of common sense. She has a kid. Kid plays soccer. Will you let your kid play soccer? Kid breaks a leg. Could be thousands of dollars. Can you afford to do that? So for Jen in New Mexico, this is going to change her family's life entirely. Matthew Lyon from the St. Albans, Vermont, writes, my wife and I are both individuals that work in human service. She's a teacher and I'm a mental health crisis clinician. In our profession, we're not going to be billionaires, but we want to live comfortably. any additional increase, especially doubling the cost of our premium, could be catastrophic. So here you have a family, just an ordinary family in Vermont, doing okay. And they're not going to become billionaires. They don't want to become billionaires. But if you double health insurance premiums in Vermont, and I know a little bit about this, which are already some of the highest in the country, it will make their lives just that much more difficult. Maybe they won't be able to go on a family vacation. Maybe what they want to get for the kids at Christmas time will not be quite possible. Maybe they will not be able to put away the kind of money they want for their kids' higher education. Just an ordinary family, and a doubling of premiums would be catastrophic for them. Ashley in Florida writes, quote, I had been hoping to move out of my parents' place and get a condo, start building some equity as I get older, but now, unlikely. Oh? So what Ashley is talking about, like many young people, she can't afford housing right now, and a significant increase in her health insurance would make it impossible to move her life in the direction that she wants to go. She wants to get out of her parents' house, start her life, get a house of her own. Can't afford it if there's a doubling of premiums. Sebastian writes from Denver, Colorado. I'm getting older, 34. Sebastian, 34 is not that old, but that's what Sebastian writes. Working a job at a small business as their marketer. They don't have benefits, and given the city I live in, I don't make enough to afford rent and food and health insurance. Only 2 of those things do I need to survive. These cuts make it even more impossible to turn things around and get a handle on health issues. So here's someone in Colorado struggling to put food on the table, pay their rent, and this is going to make his life just that much harder. Hayet from Florida writes, if my health insurance costs go up, I won't be able to have health insurance at all. I am a widow with 3 children, and I work 48 hours a week. I suffer from migraines, and my health insurance was covering the $1,000 per month cost for medication. I won't be able to get my medication any longer and will suffer. Okay? So what Hayat is writing about is she has migraines. It's a very painful disease. She gets medication, it costs $1,040 per month. She doesn't have any health care. She won't afford the medication. And you're going to have to deal with the unbearable pain of migraines. Laura from Wisconsin writes, I live in fear of whether or not I will be able to afford my life-saving treatment. I have a rare kidney disease that requires immunotherapy every 9 months. I'm terrified I will die. All over this country, there are folks like Laura who have very, very serious illnesses that are very expensive to treat. And in her case, it's a rare kidney disease. And if she doesn't have any health insurance, she will not be able to get the treatment. And I think we don't talk about this enough, and I think we don't appreciate that health care should be a human right available to all people, not a radical idea. It exists in every other major country on earth. But again, if this legislation goes through, if we let the Republicans pass their bill and implement all of these terrible health policies, people like Laura are worried that they will just not be able to continue living. Sarah from Florida writes, I have 0 option if ACA doesn't cover me. I have multiple sclerosis diagnosed in 2003, and I'm doing well thanks to diet and exercise over the decades. And every single other private insurer automatically rejects me when I disclose my MS. MS is one of several diagnoses on a drop-down list. After I submitted my application for insurance, I get a rejection email within 1 minute. So I either accept the increased price of ACA or I go uninsured. Or I move outside the United States where healthcare is comparatively cheaper. On Facebook, there is a group named Senior Nomads who all left the US in part to not be vulnerable to financial ruin due to such healthcare costs. So, once again, these huge increases in premiums will impact Sarah, a lot of other people in Florida and throughout this country. And it's interesting that she mentions this. I'd not heard of a group called Senior Nomads. But as all of you know, we pay by far the highest prices in the world for prescription drugs, something like $14,500 per person. And not only do all the other countries, major countries on earth, guarantee health care to all people, turns out that through their public health insurance programs, they are spending often less than half of what we do per capita. So even for an American going to another country, you can end up saving money on health care. But that's a pretty sad state of affairs when people have to leave their homes, have to leave their countries in order to get health care. Jason from Massachusetts writes, this will make basic health care unaffordable. We just moved into our first home, and now I am concerned that we won't be able to afford basic services like food, electricity, and housing. And again, we forget that there are many, many millions of people like Jason and his family. This is the richest country in the history of the world. And yet, because we have so much income and wealth inequality, and the people on top are so very wealthy, there are millions and millions of families like Jason's struggling not only to pay the rent, but to put food on the table, to pay for childcare, other basic necessities, and increased healthcare costs will make it that much more difficult. Joe from Pennsylvania writes, I'm a small business owner, and if my healthcare costs continue to rise, I'll be forced to close my business and look for a job if I can find one. So this is not only going to be an impact on individuals, it'll be an impact on small businesses. It will certainly be an impact, very much of an impact on nursing homes, community health centers, and rural hospitals as well. Aisha from California writes, I'm a single mom with a mortgage. I make only $60,000 a year. That means I will have to choose between paying my mortgage or paying for health care. I think that will be a no-brainer because I need a roof over my head. That also means that my child and I will be left without any health care and more than likely unable to survive. So her choice, like the choice of millions of other people, do you put a roof over your head, pay the mortgage, pay the rent, or do you cut your health care? And if you cut your health care, we all know what that means and what kind of dangers will occur. So right now, before Trump's big, beautiful bill destroys our healthcare system, 85 million are uninsured or underinsured. Add another 15 million to it, you're up to 100 million Americans who are either have no health insurance or they are underinsured. Seth from Florida writes, I have asthma and high blood pressure. If I lose my health insurance credit, I won't be able to afford a healthcare plan next year, leaving me the only option of saving money with my full-time $16 an hour job and going to the doctor for refills once or twice a year. Thankfully, my medication is cheap, but if I get very sick or I have a medical emergency, I'll be completely on my own. So there you go. $16 an hour, hard to survive any place in the country. Lose your health insurance, you are in deep trouble. Last comment comes from Nicole in Wisconsin. If my insurance premiums go up, that is going to be a real struggle for me and my family. We are already struggling to pay for groceries and insurance and bills, and we make a pretty decent wage in my family. Why make changes to affordable care? Healthcare is a necessity, and this will be devastating to so many people. Well, Nicole, what I can tell you is the motivation behind the Republicans was pretty simple. They wanted to give huge tax breaks to wealthy campaign contributors and to the billionaire class. That's what they do. And in order to come up with the money, they had to make a $1 trillion cut in Medicaid. And the result, 15 million people lose their health insurance. But Nicole is right. Healthcare is a basic necessity of life. We are the wealthiest country in the history of the world, and people from coast to coast should not have to make the terrible decisions that I just described to you from folks in all parts of the country. So thanks very much for listening. We received hundreds and hundreds of stories, and these are just the sampling of some of what we've got. Bottom line is, not hard to understand. When you double premiums for 24 million people, and when people are already having a difficult time paying for health care, it will be devastating. Throw 15 million people off the health care they had, thousands of them will simply die. That's where we're at. So I just wanted to explain all that and let you hear from people around the country to understand why I am going to do everything that I can to make sure that we end these terrible, terrible policies that Trump has imposed and his Republican friends have imposed on the American people. Thanks very much for watching.